And welcome to this Houston Newsmakers Extra. I'm talking with Dr. Peter Hotez, who is a vaccine expert, who is the Dean of the National School of Tropical Medicine at Baylor College of Medicine. Dr. Hotez, we're talking about the challenge now that we must get right after so many missteps along the way. Your biggest concern about the way this disease continues its trend in the wrong direction. Right now, more American lives are like or will be lost. And what's the biggest concern about it? Once upon a time, we thought, okay, social distancing, wear masks, all that sort of stuff. But now that we've opened a lot of businesses and people are kind of going about their lives, hanging out in bars from time to time, that kind of gets in the way of that plan, doesn't it?
That's absolutely right. We've just, here in Texas, we've been so defiant of social distancing and been defiant of masks, and that's really worked against us. We've got this very aggressive, what's called health freedom or medical freedom movement here in the state of Texas that, was not only protests against vaccines, but then they glommed on protests against masks and social distancing, and that's hurt us quite a bit.
I was going to ask you about that. the vaxxers, and there's always been a healthy anti-vaxxers movement, if you will, around the country for various reasons, different people not wanting to do it. Is that a problem? How problematic is it? Or is that group of folk who are, quote, anti-vaxxers, are they small enough so that they won't make a difference? What do you think their impact will be?
No, we already know they're doing a lot of damage, and this is really, unfortunately, Texas is one of the epicenters of the anti-vaccine movement. We've got dedicated anti-vaccine groups. Some of the leaders of the anti-vaccine movement are based in places like Austin, Texas, and that's why Texas leads the nation in the number of kids who are being denied access to their vaccinations. About 72,000 kids in the state of Texas, and now it's become a full-on anti-science movement with protests against masks and social distancing, and it's had deadly consequences, and that's one of the reasons why 30,000 Texans have lost their lives in this terrible COVID-19 pandemic, and it's gone national, unfortunately. We recently conducted a study I was involved, but it was led by Tim Callahan's group at Texas A&M. And looking at vaccine hesitancy around COVID-19 vaccines, and it's kind of interesting the findings, and it's actually almost identical to what the Kaiser Family Foundation found the month before, which is when you look at the two groups, it's what in the study we called Trump voters and what the Kaiser Family Foundation called Republicans. That's one group, and then the other is the African American community. So two very different groups for very different reasons. And so one of the things I've been doing now is I've been going on as many talk radio shows for the African American community as I can, both in Houston and nationally, and also conservative talk radio shows as well, trying to get as many people in the U.S. to understand the importance of vaccinations and how these vaccinations will save your life.
That's a very important issue. I noticed that as the vaccines have been happening, I can't help but notice there's disparities everywhere. There's disparities in the way the virus has attacked people. People of color tend to be affected more adversely. I wonder if you noticed any difference in disparities, for example, lower income people who may not have insurance, for example, or seniors. Is there a breakdown in terms of how people are impacted negatively by not being able to get the vaccine along those lines?
Yeah, absolutely. And Kimberly, you've been great on this issue, and we've talked about it a number of times. When we get that COVID-19 death report from the city of Houston, it doesn't give the names, but it gives age, sex, and race or ethnicity. And it's the same thing every day. Hispanic, 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 Black, Black, Hispanic, Hispanic. This virus has been rifling through the low-income neighborhoods for a number of reasons. One, it's mostly essential workers, people who can't make a living doing things by Zoom and Skype and are on construction sites and family-owned businesses. They're getting exposed, and then they bring it home, and oftentimes those homes are multi-generational. So you have a 22-year-old kid on a construction site bringing it home to their parents and then the grandparents, and they're getting exposed, and then high rates of comorbidities such as diabetes and hypertension. All that creates the perfect storm. And then, when you talk about vaccinating, so much of the meager infrastructure that we have in place are relying on the pharmacy chains. Where do we get our adult vaccines? I go to H-E-B or Randall's or Kroger, and there's nothing wrong with the pharmacy chains. It's just that in the low-income neighborhoods, they have a lot of pharmacy deserts. They just aren't there. There aren't that many pharmacies in places like the 3rd Ward and the 5th Ward. And so how do you reach those populations? And I think this is something the mayor and the county judge are really committed to. So we have a huge amount of work to do. One of the things that COVID-19 has done is any weakness in our health system, COVID-19 just shines a spotlight on it. And we're not looking so great as a nation right now.
Well, and the other thing is, if people don't have computers in their homes, a lot of the signups for the vaccines require you to go online.
Right, absolutely. Can you imagine we're requiring password protections and password protected sign-ons? Come on. We've got to make this simple. We have to make this as easy breezy as possible. Also, the CDC criteria, the 1A, 1B, 1C. I get the 1A, healthcare providers and nursing home residents, but after that, it just starts getting very complicated. And who's going to be the gatekeeper? How is a pharmacist at Randall's going to know, who's an essential worker or what the specific risk factors? It's unfair to her to make her be the gatekeeper like that. So, I think all of these restrictions and rationing were well intentioned, but don't really reflect the reality of what it means to be vaccinating 2 million Americans every day in order to get up to speed. So we've got to find mechanisms to make this as high throughput as possible. And I was happy to hear about the Biden administration's remarks last night. The president-elect, more or less, touched on a lot of those points, which I put out in an op-ed piece in the Washington Post on Monday, which basically says this is what we've got to toss all the cards and really say, okay, are we serious about vaccinating 2 million Americans a day? This is what has to happen.
You've been in this business a long time. What has this COVID-19 pandemic taught us about what's needed to prepare for future incidences like this? Because it's inevitable something like this is likely to happen down the road. Maybe not to this extent, but what have we learned from this pandemic? Well,
I still don't really understand why we've come up small in every instance. What has gone on? I understand the White House incursions and the disinformation campaign that came out of the White House that I fought so hard against, that tried to downplay the severity of the pandemic or said it was a hoax or saying COVID-19 deaths were due to other causes or discrediting masks or spectacularizing hydroxychloroquine and all that nonsense. I get that. But beyond that, I just worry that our health and human services agencies faltered. They couldn't organize the epidemiologic models. They couldn't provide a roadmap for the nation. They missed the entry of the virus coming in from Europe into New York. They couldn't organize themselves to do the genomic sequencing. The diagnostic testing was a debacle. And now we don't have an infrastructure to vaccinate. How as a nation could we have been so inept and incompetent? And that scares me. And how we're going to fix it, I think, is going to be a top priority.
Well, I look forward to hearing from you along the way. I know we haven't talked in a while, but I know that you're always available to bring us your expertise. I appreciate you. Thank you so much. Stay safe. I know I don't have to tell you that, but I'm going to say it anyway. Stay safe, and I look forward to seeing you down the road.